And welcome back to the True Sports Physical Therapy Podcast. I'm excited to have Jamie Phillips with us. Jamie Phillips is a new grad and a hockey aficionado. Even more specifically, this guy lives and breathes goalie strength and conditioning, and now rehabilitation. Jamie, welcome to the family. Welcome to the podcast.
Hey, thanks for having me on. I appreciate your time.
Jamie, tell me how you got to where you are, what makes you so interested in strength and conditioning for goalies, and tell me about your burgeoning new practice that you're working on.
Okay, well, let's get into it. So, yeah, new grad, just graduated officially last weekend. So excited about that. Thank you. So I did my undergrad at Michigan Tech University, undergrad in kinesiology, like probably most of the listeners here. Pretty basic. I went in there on a hockey scholarship. So like they say, student athlete, but I was definitely there for athletics first. Prior to college, I was drafted in the NHL. So the goal was always to go pro, hopefully go to the NHL, make millions of dollars, and live happily ever after. Ended up signing in the NHL, but just never made the millions of dollars. So I played in the minor league system, the American League, East Coast League. Started to, I did really well, just got like burnt out. So when my career was winding down, I'd gone over to Europe trying to figure out like, okay, what do I want to do? I had an opportunity to coach Division I hockey and go back to school. And since it had been a few years since a lot of those like prerequisite classes that I'd taken, I had to redo some of them or take up other classes to kind of bridge that gap. So I went back to school, got a master's while I was coaching. And then the Central Michigan program had a satellite campus at Michigan Tech. So the first 2 years of DPT school, I was able to coach and do the school part. And then when I moved down here to Grand Rapids for my clinical rotation, that's how I finished everything up. So in that time between, I actually, like when I first got into PT school, I didn't really know what I wanted to do. I kind of went through a bit of an identity crisis where I was burnt out with hockey. I didn't really want to be involved with it. I was kind of mad, every time you retire, you're not as happy as things are. And then once I kind of got back in that coaching field, got more involved in the strength conditioning part. I mean, I had my CSCS from before that because I was training athletes on the side. And I realized, okay, like there's a gap here that needs to be filled. I have a passion in coaching goalies on the ice and I love hockey. So let's just go all in on the sports rehab, the hockey rehab part. And let's focus primarily on goalies, but make sure that, I'm well educated enough in the goalie coach, in the player rehab portion as well.
Yeah, and tell me what's so different about rehabbing a hockey player.
That's a good question. There's a lot of answers that I can give you, but typically when it comes to, try to speak broadly here. So broadly for hockey and goalies, bunching them into one is the positions are very like quote unquote not good. So anything we think of like internal rotation, hip flexion, all those positions that we're taught and told like, hey, you got to avoid all these things. But that is where hockey players spend their time. Hips internally rotated. Goalies are in an internally rotated flex position, their hips, and now they're slamming their hips into the ice. Players are extending from a flex position under high loads. They're stopping the acceleration, deceleration. Then we look at ankles. Their ankles are locked in, in a skate. So high ankle sprains are more common than like a low ankle sprain. All sorts of things. You have both contact to the head, contact at high velocity. Typically it's not as much of the mass because hockey players aren't as large as say like a football player or like a lineman, but they're coming at higher speeds. They're coming at different directions. You're standing with basically knives on your feet. There's so many different variables that come into it, but typically where the injuries tend to be are those overuse injuries of the hips and groins.
Are there more normal ranges of motion for a hockey player than there would be for a field athlete?
It's a good question. Again, that depends. It depends what you're looking at. Everyone comes in so much different, and it's hockey is a weird sport where you don't have like you often have like really good athletes. I'm going to make sure I explain this well. You have a lot of really good athletes, but you don't tend to have those kind of crazy outlier athletes. So you think of someone like a like a LeBron James or like a Michael Jordan or any of these players that are just physical specimens.
Yeah.
Then you have hockey players. Now, hockey players in general are becoming better and better athletes, but there are still players at the highest level that are not great traditional athletes. They wouldn't fit that mold of what you would classically describe as a great athlete, yet they're very, very good at hockey. It's same as something sort of like a golf, where golf is super specific, where if you are a very good golfer, you don't have to be the best athlete. So like John Daly obviously isn't the best athlete. He's a very good golfer. Where hockey, you don't have to be this freak, where it helps. And I say freak in a good way. You don't have to be this outlier, because it helps with to have that. But because it's so specialized, if you are good at all the other underlying skills, you can still be successful. So when it comes to ranges and norms, I typically it's more about working within that athlete's current ranges or current availability, and trying to make sure that they are playing pain-free, playing discomfort-free, and getting them back to the ice.
Yeah. Now I'll give you a great example. By the way, I love that you didn't include baseball as a sport in which that you can excel and maybe not be a freak athlete, but you find physical freakiness in these successful athletes, right? So a pitcher might look super sloppy, or if you want to take the John Daly example, God knows the guy looks super sloppy, but I bet you his thoracic rotation is off the charts. I bet you his hip rotation is incredible. So when you're looking at these hockey guys, in order to excel, they probably have insane ranges of hip internal rotation. What types of adaptions, I guess, are you seeing in these athletes that correlates to success on the ice?
Yeah, funny enough, the ranges is really broad. I'll have, especially with goalies, I'll have goalies that come in and their hip internal ranges of motion is just like, they're at 50, 60 degrees, and it's of active range of motion, and it's insane. And then I'll have goalies that will come in and they're at like 15, 20.
Yep.
But they're still high caliber like goalies. And it's just because there's no like one size fits all textbook. Now, as the more internal rotation, the wider like your butterfly is going to be, the better it is. It's better to have that than to not have it. But if you don't have it, okay, you can still be successful inside your anatomical, I wouldn't say limitations, but your anatomical variance or whatever you're able to achieve, but you have to adjust your game. So if you're a goalie who is super flexible, you can get away with being a little late or not having the best, tracking or anything like that, because your flexibility will bail you out. But if you don't have that flexibility, then you have to control your rebounds better. You have to play a little bit deeper because you need to have a less distance from A to B. And so typically there's no like one size fits all, but because you'll get a whole wide range. And when it comes to players, no one really like talks too much about internal rotation, because that rotation isn't as necessary as it is for a goalie. It typically comes down to that, like it's more of a strength component. But what we see, or we've been seeing now, is more and more athletes are getting diagnosed, I'm going to say that in quotations, diagnosed with FAI earlier on. And as we know, as PTs, surgeons love surgery. So we have a lot more young athletes going through surgery, whether it's warranted or not. That's another discussion for another day. Yeah. But we're seeing a lot more FAI, a lot of hip discomfort. And then I'm curious to see if there is going to be a long-term study in like terms of bony abnormalities, although to do that study would be really difficult. But it is typically the hip pinching, hip pain, groin pain is the really common injury we see in both hockey players and goalies.
Okay, so how is the rehab, let's take a hockey goalie, how is the rehab for an FAI different for a hockey goalie than anyone else on the ice and then any other general athlete?
The basic principles are going to be the same for everyone. So like what's the root cause? Is it a structural thing? Is it labrum? Is it something to do with, instability? Is it even, is it the muscular, is it your TFL or something with your psoas, clicking in terms of whenever you're moving your hip? And then from there, the steps in terms of getting someone playing without discomfort again and back on the ice are going to be the same. It's going to have that strengthening and stretching, as well as, a lot of end range stuff, control stuff, Whether that's through joint mobs or anything like that. Every PT is going to have their own specialty and way that they like to get to the same outcome. But where it's different with goalies is their position is that position we tell everyone to stay away from. We tell athletes, okay, like, let's try not to do too much, internal rotation, hip flexion. Or if we're going to do this, like, let's not have it a lot of force. We'd never, basically you take something like W sitting, which is sort of what a goalie butterfly is, and we say, like, don't do that. Yet if that's the position a goalie needs to get into, how can we get back to this safely? For me, when I look at, or when I'm designing a treatment for a goalie, I try to strengthen all the antagonists as much as I'm strengthening the agonist muscles, just to support that joint completely. And I really try not to do too much specific positioning things off the ice, and I save that for on ice stuff, because if we know that those positions aren't super great long term or whatever for a goalie, if I can save all that internal rotation, all the hip flexion under high loads, high velocity, I'm going to save that for the ice rather than to do it in the gym and then have them go on the ice and then come back to the gym and then again and again and again. Where, keep that training and that rehab part to just like general, like even like compound movements, general strengthening stuff, general stretching stuff, and then apply that into specifically once they get onto the ice.
Okay, so what's an example of a rehab exercise on the ice that you wouldn't do off the ice?
Honestly, just like even just a classic butterfly position. Like,
You just have them drop into it, the
so
butterfly.
for those that are listening or watching that aren't familiar, you think about just standing in like a general athletic stance, and then allowing your ankles to roll into a little bit of eversion, keep internally rotating your hips, and then dropping your knees down to the ice. Now there are pads that cushion some of that fall, but it is pretty intensive. So that position will give some goalies discomfort, and then extending from that position typically is where most goalies will have the most amount of pain. So in that position itself, I'm not going to, whether that's doing butterflies into an air X or anything like that. If they're having pain in a just general butterfly, then we'll go through even simple things, just like adduction, abduction, stretching, and strengthening. And as long as those are pain-free motions, then I'll have them go practice, tell me how did it feel, then come back. Well, it felt good for the first 10, and then it started to feel that again. Okay, now we're looking at some sort of endurance thing. Okay, so then let's go and let's do these under longer loads, longer durations. Let's get stronger, and again and again and again, versus using that same mechanism that's causing that discomfort in the beginning, just doing that again and again and again, and repetition. And that's where I find where there's not a lot of former professional or former like high level hockey players going back into PT, or really anywhere in medical fields. And so when I look on the internet, which I probably shouldn't do, when we see like other trainers and stuff, training in that classic like sports specific training stuff, that's kind of from my point of view is what they're getting wrong, is they're just trying to recreate those positions in the gym rather than improve physical attributes, and then that are going to have high carryover onto the ice.
Okay, so that makes total sense. By the way, it sounds very similar to I'll see a lot of PTs, and God knows I've been guilty of it as well with runners, where the activity is not what's going to be a strengthener. You need to strengthen in order to perform the activity. Same thing here with goalies. You need to get them strong in the gym and then translate it to ice, as opposed to just like go out and run. Your legs are going to get stronger. We know that's not the case, right? You got to load them appropriately inside the gym. So are you using med balls or resistance bands, et cetera, on the ice? Are you putting them in skates, in pads, and having them do strength and conditioning on the ice?
No, so for me, absolutely not. And this is where I am very
Can
vocal.
can you tell how many goalies I've rehabbed? Okay, go ahead.
Yeah, no, and I don't mean that in a bad way. I'm very, very much against. Like I said, I like to keep the gym and the ice separate. When you're in the gym to be the best athlete you can be. When you're on the ice, you're on the ice to be the best goalie or forward or defenseman you can be. There's a couple of reasons for that. When we think about just actual training, like sport specificity, the most specific thing you're going to do is your sport. So if we don't need to add unnecessary load or, other than something sort of maybe like an overspeed, but other like general, like, med ball, or even I saw yesterday, like people were using tidal tanks and stuff, which on the surface, it seems like, oh, that makes a lot of sense. But when you actually start to boil it down, we think about, okay, like, well, we want our biomechanics to be as specific as possible. We want that neuroplasticity to be as specific as possible. When we start to throw in, constraints that are, especially like adding different forces or velocity to our body, that's going to mess up our biomechanics. It's training the wrong attributes. This is probably the easiest way to say it. And then also, like, hockey is super expensive, and like it's a very expensive sport. So if you're paying $300 an hour for ice, and you're going to waste some of your time doing, we call them power pushes. So like basically like being on your knees and like pushing continuously on your knees with a tidal tank, well, to get stronger legs, you could get stronger legs in the gym squatting or doing lateral lunges and get the same benefit for way less money, and actually probably get significantly more benefit because you're also not messing up your technique. And you look at something like baseball, like I think, there's a couple studies been done that show that range variance between throwing a weighted ball versus like a lighter ball. And it's like, it's something like 6%. I might have butchered that number. I'm not a baseball guy. So someone's there punching their steering wheel right now, listening to this.
Yeah.
It's really small range. You don't have baseball players throwing, shot put balls, because we know that messes up the mechanics. It's not good for the shoulder. Yet in like hockey and goaltending it's such a slow evolving sport in the sports science like realms compared to all the other major sports in the world, that people are still doing these things. And, is it going to hurt them as a goalie? Probably not. But is it the most beneficial thing you're going to be doing? Probably not either. So for me, like, I keep that separation. I try to keep things separate.
Okay, so that's really interesting. If I take the financial side out of it, where you're paying for ice time and that matters, my fault as a novice physical therapist that I am, that those goalie mechanics, and you touched on it previously, are different when they're in skates, when their ankle is totally locked up, when they're on those swords versus in Nikes on turf in my facility, right? So is there any room in which you're able to mimic the movement, you're able to mimic the constraints in terms of putting them on the ice, putting them on the sword, putting them in those skates, and asking to hit the function, maybe under some load with a band, slow and controlled, maybe you're playing with tempo, whatever it is, work on the ranges that are pain-free, obviously not hurting them, but now you're doing a great job of mimicking that which is their sport, that which is their demand, right? Is there any room for that?
I definitely think there is room, and it's finding that balance between, let's just take the butterfly position again. So I use the example where I'm not really going to have them doing butterflies onto a Bosu or onto an Airex. However, if we go through a full treatment and at the end, and I'll ask them, hey, do a couple butterflies on the pad, tell me how that feels. If it feels good, then I'll be like, okay, that gives me more direction in terms of, yes, you can come back to the ice, or no, we're not there yet, versus loading someone up with a weight vest and then having them butterfly. It's because, well, I want you to be stronger in this position, so I'm going to load it, even though this position is a position of discomfort. So I think that's where that range is. It's more of a test retest kind of mentality, because you can take, say like a hip 90-90, and you can do internal rotation in that position, and you're at a very excessive end range of hip flexion and internal rotation, and it's not going to be as taxing or as putting as much force through the joint as a really specific goalie position would be. And I think that from my point of view, in my opinion, is I think you can get the same amount or more benefit that way, and safer long term from the rehab point of view, than it is to load up positions that are causing those positions of discomfort. Again, use the baseball pitcher. Okay, pitcher's coming in and they're having medial epicondyle pain. Okay, so we can either have them, put them in, excessive elbow valgus at a 90 position and then have them, I don't know, whatever it is, loaded up. Well, that pain, that's causing the pain. Well, they're not there yet. Okay, so let's go through the rehab and then let's have them throw a couple pitches at 20%, 30%. Okay, you feel good? Try 50. Feel good? Let's try 3 at 75. Cap it out today. No more, no more high velocity throwing. Let's do your rehab. And then maybe when they can pitch, 3 or 4 times in the clinic at 100%. Okay, I want you to go through a practice. And so it's finding that there is like a little bit of that art of finding the fine line. But in terms of the way that I approach it with my goalies, I try not to be as specific, because those specific positions are the ones of discomfort.
Yeah. And for me, it's getting as close to that specific move, keeping them pain-free, keeping it challenging, keeping their engagement high, so that I can keep them in the game, and hopefully seeing dividends following that. I think that's the way I would approach it, regardless of sport. So give me some, when you come and interview at True Sports to be a sports PT with us, I give you a case, and the case we often use is an ACL that has gone elsewhere, was taught how to do straight leg raises, was taught how to do quad sets, and they were taught how to do it piss poor. It's clear that the PT didn't understand that the knee needs to get to terminal extension, the heel needs to pop, quad needs to all the way engage, patella needs to sit inside its femoral groove. They just kind of miss that low-hanging fruit. That's the case that I give to applicants. What is something that you see time and again where a goalie will go elsewhere to one of your standard PT models, and then they show up and see you, and you're like, Jesus Christ, like, how did the PT not see this?
Yeah. The first one is the classic. Well, you first stop playing. Like, don't go on the ice.
It's they leave them in too long.
Yeah.
Or they pull them out too early.
Yeah. Or pull them out too early, or just pull them out in general. Like, it's one thing, okay, you tore there's obvious groin tear. Okay. Yeah. Like, we're not going to come on the ice, but it's like, oh, my hip's bothering me. They'll hear, well, stop playing for the next 2 weeks. Well, in high level sports, you can't afford to do that. Even in like minor hockey sports, you can't always afford to do that. So that's the first one. The second one is, when dealing with goalies, is most of the time, a lot of PTs, just because hockey is a very niche sport. And so this isn't like knocking the PT itself. It's just, you don't come across a lot of goalies. It's the comprehending of what that position actually means. So when you explain to someone, hey, yeah, like, I go into excessive hip flexion, internal rotation, I slam my knees into the ice. People are like, what the heck does that even mean? And then you're like, well, and then if someone was versed, so sorry, someone, like, shameless plug to the goalie science podcast that I run, you'll know that the butterfly isn't even the worst position for your hips, according to the few studies we have out there. It's like stopping yourself as a T push. So anytime that you're pushing forward and your foot's going from like a neutral position to kind of like how to describe it. You're basically turning your hip into internal rotation in order to stop yourself, like you would on like a French fry stop if you were skiing.
Yep.
So that's the worst position for your hip, because all those forces just go right through that lead leg joint in internal rotation. And so explaining that to a PT, they're like, well, again, they'll usually just say, well, stop doing that, or like, I don't know. And then they go down a general sense. So where I find that most goalies are lacking, it's strength. It's just honestly general strength. They're over the past, let's just probably 20-ish years, as training for goaltending has gotten better and evolved, and hockey players in general, the idea again of that sports specific training has really been pushed to the forefront. And now it's kind of coming back to just generally being a good athlete, because so many goalies are going through injuries. They're just not strong enough. There's, the stereotype of a goalie as being the worst athlete on their team. There's a lot of truth to that. You'll see a lot of goalies will come into fitness testing and they'll have the worst jump. They'll have the worst squat, the worst bench. Well, and then the argument would be like, well, my trainer said that I don't need to do these because goalies don't need to be strong. They just need to be flexible. Mm-hmm. And you're like, wow, that's actually not the case. You need to be both. You need to be the best athlete because you need to be incredibly strong. You need to be incredibly fast, agile, flexible. You have to have everything. Yet most of the time, goalies will train in the realm of flexibility. I spoke with a goalie not too long ago, interviewing him for like my online training program. And he's like, I asked him what he did for training. And he's like, yeah, I just do like mainly like a lot of like hip cars and like step over hurdles and stuff. And I was like, that's great. Like, okay, like good warm up. What do you do?
What else? Yep.
He's like, no, he's like, that's my training. I'm like, oh man, okay. Well, like this is how I approach things. Like those are great. And all my programs include those, but that's like the warm up or cool down. Like we're going to do, whether it's a clean or a modified clean, just a clean pull or a trap bar deadlift or trap bar jump, we're going to get you strong, and we're going to get you strong at good end ranges safely so that you have these transferable skills. And I have so many goalies will come to me, especially when they go from like junior hockey to college, and they go to college with real strength coaches who have gone through the ringer. They, and this isn't to throw shade or anything, but they've gone through more than like a weekend, NAWSM certification. They're giving them good training, and they want them to squat, front squat, back squat. They want them to clean. They want them to snatch. And these athletes are 21 years old and they've never done these things. And now they take key developmental years from whether it's 18 to 25, because hockey is a little bit of an older sport in college, like 18 to 25, where they're going through their tail end of puberty. They're ready to get stronger and become incredible athletes, yet they have to spend all that time learning the baseline fundamentals because they weren't taught that from ages 13 up. And that's kind of where hockey falls behind in some realms. There's still a lot of incredible trainers out there that in my mind are doing things the right way, but there's still a lot that are kind of, just like mobility. Don't worry about strength. And then these athletes have to be able to accept load under high force, and they can't. And I know I'm rambling here, but I always give,
that's great.
Yeah, I always give the I guess the analogy or metaphor, like I have two goalies or two players that are equal in skill, 100% skill. They can stop the same amount of pucks, same height, same everything. One can back squat 400 pounds and the other can back squat, 135. Is a back squat going to make you a better goalie? Probably not. But which one of those goalies is going to have more resilience and the more strength to handle all the loads placed on the body over the course of a 60-game season, where kids are just actually, now it's even more, kids are playing like 100 games, which is insane, but they're just playing games and practicing. Who's going to have the ability to recover from that, to handle that? And it's going to be, probably the athlete who can handle 400 pounds on their back. Yet people will be like, you don't need that. And it's also the same people that would be like, oh, like goalie's so dangerous for you, but it's because it's so dangerous, we're not going to get our athletes stronger. And it's like, no, you're looking at it wrong. Like you're looking at it the wrong way. We need to look at like injuries. What are the most common causes of injuries, and what can we do to kind of reduce the likelihood of those occurring? And it's typically being strong in end ranges of motion, and making sure that we manage training load.
I think you boiling it down that simply is really helpful. It's helpful to our audience. It sounds like what Eric Cressy brought to the baseball world, which is it used to be that pitchers, they weren't doing any chest press, right? They were never allowed to do anything Olympic. They weren't certainly not allowed to press overhead. And he kind of started to break that mold of building the engine, right? Building the resiliency to keep you healthier and to address the entire athlete. And we had Coach Jeff Lavecchio on recently, and he was talking very similarly about in the hockey world, building this overall strength and capability and how important that is. And I think that goes across all sports. I'll tell you, I mean, being in Maryland, we see it a ton in the lacrosse world, where these athletes go to these Power 5 schools. They're Power 5 schools because they're football schools. So you get elite level strength and conditioning. And it used to be these lacrosse athletes had never put a barbell on their back. And they were totally flummoxed by that concept. And by the way, it would break down because of it. And now you're starting to see it far more. We work with great coaches like Courtney Green or Jay Dyer, who are loading these athletes and more so teaching them how to survive and thrive in a college weight room, similar to what you're describing, so that they're able to walk into college and make gains as opposed to having to start from the baseline of whatever it is their movement is. So it's good to hear that that's kind of coming up in the hockey world. I think Canada is really the mecca of hockey performance, right? Even though it's not their national sport, lacrosse is. True Sports Physical Therapy is growing like wildfire. We have 14 locations, soon to be more. We are throughout the state of Maryland, We're in Pennsylvania, in Lebanon and York, Pennsylvania, as well as in Delaware, in Newark and Wilmington, Delaware. Like I said, so many more practices to come, and we always need outstanding sports physical therapists. Our treatment style is unique. We are one-on-one with your athlete for 45 minutes every single session. You do the entire treatment, you do the entire evaluation, and they are in state-of-the-art facilities where you have room to run, throw, and jump, and really get your athlete all the way back to on the field and better and stronger than they were. We also have outstanding salaries, comp structures, bonus abilities, 401ks, as well as a very strong continuing education offering, including in-house continuing education. And we're looking for you. Now is the time, as we are growing like crazy. Just shoot your resume over to Yoni, Y-O-N-I, at True Sports PT, or shoot us a DM and we will hit you back. We will get you in for our unique, tried and true interview process and really make a determination that this is the right place for you to grow your career and get your athletes better than ever. We can't wait to hear from you. So how does it differ based upon geographic region, would you say, this knowledge base of strength and conditioning for the elite level hockey player and rehab?
Oh, that's a good question. I think they're very similar. So obviously Canada, we, as a Canadian, we like to take credit for all of,
you sound like a Canadian.
All of hockey, anything ever that's good in hockey, we like to take credit for it. I actually think that Europe and the USA, I think from what I've experienced and from what I know is I think they're pushing things forward more so than Canada. There's a lot of politics going into the Hockey Canada and things, and that's a whole bunch of things there. Essentially, the model that Canada has is this really survival of the fittest model, where because we have so many hockey players, you're just going to have a lot of really good ones, and that cream is going to rise. And so you don't need to put a ton of investment, like the Hockey Canada itself doesn't need to input a ton of money and stuff into overall development for youth athletes, because you're always going to have enrollment and you're always going to have players. And because the private coaching sphere is so large, like I'm included in that as well, the private coaching sphere is so large, they're always going to have some of the best athletes. Now in USA, America has done a really good job with USA Hockey and promoting hockey itself, getting more players into the sport. Again, it's still very expensive. I don't know how that will ever change, but it's still very expensive to get into. But now you're getting more players, and you're getting them with the expansion of the NHL. You're getting them in non-traditional markets, and just by increasing the numbers, you're going to continue to get good athletes. But having the structure of college and the way that college sports can develop athletes, I think, is one of the best ways to develop people athletically. And now if you look at those top power schools in like football and stuff, especially when it comes to like high school, it's basically just a miniature college for high school kids. That doesn't typically exist in hockey, because most high level players will play club sports. But just having the opportunity to go on into college where you get all this training is really where a lot of that benefit's coming from. In Europe, what they're doing well is they like to do a lot of hockey research, where in Canada and the United States, we don't do a ton of good research in hockey. The NHL itself doesn't actively promote it as well as some like Major League Baseball, or if you look at like Premier League soccer or anything like that, they have their academies and they're just pumping out studies, and they're just and that sports performance. Or you look at Australia, you take like Aussie rules football or rugby, like every single week in my inbox, there's a new study coming out of Australia. I can't even tell you the last time I got a new study out of anywhere for hockey other than Sweden, like 3 years ago. And it's because it's just not, whether that's a money thing or incentive thing, it's just not there. But I think from my point of view, USA having that college hockey model and development model in the culture itself is kind of the way that I would promote things, whether that's better youth sport development, better high school sport development, and just so that feeds into itself like football does, like basketball and baseball do.
Yeah. What would you want to research? What do you think we don't know about your sport?
That's a good question. I think a lot more in concussions would be good. Concussions would also be similar to like the NFL, how you really don't want to research concussions because you're probably going to get bad
Right.
news. So no news is good news.
Yeah.
I would like to look more at like again like joint forces, and then any sort of like long-term structural changes that might occur specifically in goalies, as well as like load management stuff. There's been a little bit more studies out of Sweden in terms of load management for goalies and injury. Um, and then actually my podcast partner he more works in like data and analytics. He's getting his PhD in that, but he's also doing a few things when it comes to load management in Canadian university athletes. But I would like to see that load management part, because if you look at like baseball, pitchers don't pitch every single night, and they often have 5 to 6 pitchers on a major league team that like rotate through. In hockey, we're now starting to get away from like a true number one goalie who's going to play 65 out of 82 games. And we're starting to get more of that 1A, 1B system. And then I think there should honestly be a 1A, 1B, and then even like a 1C. So that goalie that's in the American League will come up and play 10, 15 games just to take some of that load off of the two full-time goalies, or having a full-time paid practice goalie whose job it is just to practice and do well and be available to play, while those two guys can just take nights off and days off.
Yeah. I want to know I think those are really interesting things to to research. I've always wondered about the substitution patterns across sports. I think it's really interesting that we keep the same offensive lineman in football on the field for every single snap. By and large, it is not a free substitution model like you'll see with corners, or like even you'll see with DNs, where you'll freely substitute depending upon fatigue. Those O linemen, doesn't matter how tired you are, you're staying out there. And I've asked guys about that, and they think it's because of there's just such a serious drop off between the fifth O lineman and the next guy up that we want to keep that guy on the bench. I just wonder if that's true, but that smacks of what you're talking about with the substitution pattern or the player load management of a given player. Is it better to let him rest, come back at 100%, or keep that guy at 70%, run him into the ground versus the guy behind him? But I want to know about what are the number one correlational factors in the gym that translate to success on the ice. Baseball's really good at that. Like baseball knows that your velocity goes up incrementally based upon, or correlationally speaking, to how good your lateral jump is. So we want to train lateral jump. We know it's going to translate to your on-field velocity. That's fascinating. We've talked about injuries in the baseball world, and does grip strength matter? Does individual finger dexterity, does that matter for UCL protectors? They haven't really come up with that. But what do you think is most correlative to success from a weight room to the rink?
Yeah, that's a great question. So I don't know of any research off the top of my head that would give.
What do you think it is? What do you think?
Yeah, it would have to be complete anecdotal. That is a really good question. And I would probably have to say something to do with just general vertical or broad jump, just explosive power, which would give someone that ability to, whether they're forward, to take those first couple quick strides and be able to accelerate. If you're a goalie, be able to push off the post and get set quick. Because the quicker you can get set, the faster you're in position, the more likely you are to make a save. So I would think that it's going to be something like a broad jump, or I'd actually probably say broad jump over vertical jump, because you're going to get a little bit more of that, that linear drive, which is going to translate a little bit more to like a hockey stride. And then we look at those like the attributes that improve that, like strength is going to be a massive component of it. The force, the speed of of muscle contraction is going to be a part of it. So things that are trainable through strength, through explosive power, through plyometrics, through Olympic lifts are going to improve, that broad jump, that vertical jump. So for me, that's what that factor would be. But you look at hockey, there's so
you
again, like I said,
wouldn't want to look more laterally. I'm surprised you didn't go with something more laterally.
For a goalie, it might be something more laterally. For a player, there's almost always some sort of like sagittal motion, whether they're moving forward and to the side or they're moving backwards and to the side, but it's very, very rarely true frontal plane motions. For a goalie, you are going to get a lot of true frontal plane motions.
Yeah.
But if we look at some of the research there that shows like broad jumps and vertical jumps and how they translate to lateral movement, they're highly correlated.
Yep.
So you can, and so then it comes down to like a testing thing. It's like, okay, we're doing a combine. Is it safer for my athletes to do a broad jump, or is it safer for them to do a lateral jump with a single leg stick? Well, in the general sense, probably a broad jump. And then we got to make sure that all our athletes can do single leg plyometrics before we jump into that. And that would be another thing that is a pet peeve, is basically like us as PTs, I think we need to do a better job of like not showcasing the most advanced, high skill, like plyometric drills.
Yeah.
And then because like those are cool and they get clicks, but like when you have a lot of, you'd be surprised how many athletes like watch like our pages and will make their own workouts based on Instagram exercises.
Yeah.
Instead of like, oh, okay, so we know that in doing plyometrics, we should start in just like pogo jumps and work our way up to depth jumps. Instead, you'll have kids that are doing like banded depth jump, dumbbell, ice, like all these, like, add in every word you can throw in. And that's what they're starting with.
Yep.
And then they're wondering why they're not progressing or they're getting hurt. So like, that's another massive pet peeve I have.
No, I could totally see that. I think a big piece is similar to throwing is the ability to produce force throughout the entire kinetic chain, right? And so when we look at throwing at high levels of velocity, we look at the core's ability to essentially attach or translate the force from lower extremity to upper extremity, and then eventually to your fingertips at release. How important is that in the hockey world, and how do you train that?
Incredibly important. If you look at just a player taking a shot, similar to a baseball pitch or a golf swing, where it's not just your shoulder in isolation. You're getting that power through your torso, through your hips, through your shoulders. Like everything is involved. For a goalie, a lot of those movements are coming from that. The rotational and push components are coming from your core. Your upper body doesn't do as much. It's more along for the ride. Your core and hips are in charge of it for goalies. When it comes to training, so you can train in what some people would call like functional patterns. And I think that there is some benefit to that. But again, for like the way that I approach it is like, how do we get the most bang for our buck? Okay. So we're looking at core rotation. Okay. Am I going to weight a hockey stick, or am I going to have someone on a Kaiser machine or a cable machine just do some explosive pal off rotations? Well, you can get some pal off rotations. You're going to get stronger that way. We're going to get our hips stronger through general exercises. And then when they get on the ice, or make sure that they're going into the garage and shooting 500 pucks a day, and now they're getting specific practice. I think like there's a lot of different ways to skin a cat, but I like to take that approach of just becoming a really good general athlete, and then all the specific training work, save that for being on the ice.
Yeah. Inside the gym, is there anything you think that you do with even specifically your goalies that is nuanced and position specific that a general sports PT wouldn't do as much?
Yeah, probably.
What are they? Tell me what they are, Jamie.
Yeah, where it's more about the attribute stuff. So it's not getting them in those positions, but doing a lot of like hip cars, doing a lot of hip pails and rails in internal rotation, just kind of in those classic kin stretch or functional range strength positions.
Yep.
So I think a lot of those, or even just like strengthening hip internal rotation, whether you're lying supine 90-90 with knees squeezing a foam roller, and you have a TheraBand and you're just strengthening it, just like getting stronger in some of those positions versus loading up some goalie with their gear. And so is there anything that's like ultra nuanced? Not really. Definitely not in strength, just general strength conditioning. When it comes to injury rehab, possibly, but I'm going to make those decisions on like a patient by patient basis versus having like a one size fits all plan. If someone's really truly having problems with, there's a there's a position called like a reverse vertical horizontal, or RVH, which is like, I don't even know how to describe it. Essentially, you're like leaning into the post in like the most awkward looking position. And if someone is having trouble with that, then yeah, I might put them in that position, like against the wall.
Mm-hmm.
Again, I would only use that as like a test retest. Like, is this causing you pain? Yes. Okay. We need to where? Oh, okay. So it's something in your ankle. Okay. Let's look at, anterior tib or posterior tib, or figure something out that way. Or no. Okay. Like, go try a few of those on the ice and see how that feels.
Okay, and this is them just leaning to the side and trying to push the wall to the side and behind them?
Yeah, I would say so. It's like, I don't even know how to describe. It's so hard to describe. So if you're not driving, just pull it up on your phone and just type in goalie RVH, and you'll see what that position looks like. It's essentially, I don't think I have an image hanging out in my room. You're like, whatever leg's closest to the post is flat on the ice in internal rotation. The other leg is extended to the side, and you are leaning against the post, trying to be as tall as possible with your shoulders over your hips. And your ankle is like torqued in eversion dorsiflexion, with all your weight transferred into that ankle, the post side ankle, knee, and hip. Oh, it's horrible. Yeah, no, it's not great. So I'm not going to load that any more than it needs to be loaded. Plus, you also have to get in that position by pushing as hard as you can. And then that post is going to stop you. So there's that sudden impact into that horrible position. And a lot of goalies have pain there. So it's to figure out where in their body are they having pain, at what point of the RVH are they having pain, how can we improve that, and then use that position as a test retest, and then get them out there. Oh, and then now they're pain free. Okay, they don't have pain in that RVH. Okay, it means they were weak in XYZ. Okay, let's continue to strengthen that. Make sure that we work on those accessory muscles so that those don't, get inhibited or anything long term, kind of thing.
Yeah, but I like it as a universal or like a systemic assessment, and like you said, using it as a pre-test, post-test. I think there's a lot of valuable data on there. So I will definitely be Googling RVH.
And when we think about training athletes too, and like, obviously for me, like, I'm fresh out of school, I don't have as much clinical experience, but especially when you're fresh out of school, you get your special tests, you get your outcome measures, you get all these things where they're like, okay, like, these are the gold standards. And when we look at like sports PT and like sports performance, there is like, it's both a incredibly specific art tied with pseudoscience, tied with all these things, and it all comes into one. But for me, I really just like to use the sport itself as that test retest. If they're having pain in their sport, okay, use that as a test retest. Because honestly, like, for us as PT, yeah, we're gonna come in and be like, oh, I really care about what our handheld dynamometer says. And like, again, if you are operating in an insurance-based model, then yeah, you got to show, progress and show these things. But your athlete doesn't really care what their shoulder abduction strength is.
Yep.
You just want to know if they can receive a hit without pain, or can they shoot a puck pain-free? And so for them, and getting a lot of that buy-in, I like to use that as my test retest on top of the other things, because I can show like, hey, like, you have gotten stronger. Like, look what the dynamometer says, and I go, sweet, great. Yeah, but my shoulder still fucking hurts.
Yeah.
Like, oh, well, the dynamometer says this. It's like, okay, your dynamometer is getting better, or it's staying stagnated, but you're not having pain, you're not having discomfort. Sweet. Let's try to get you stronger. But I'm glad that we can get you back to the ice pain-free. Let's continue to work to grow and progress so this doesn't happen again. So I like to use those specific positions that are causing pain as part of my test retest.
Yeah. Okay. Well, I think that's powerful. That's a great lesson. You sound more like a vet than a new grad. Hey guys, quick pause and a quick shout out to this new masterclass that we just launched here at True Sports Physical Therapy. Myself and Dr. Tim Stone put together a masterclass of ACL rehab, and we call it From Table to Turf. And the reason we call it that is because it's going to teach you exactly how to get your athlete all the way from post-op day one, with the nitty-gritty of regaining all of that range of motion, with the tips and the tricks that we use here at True Sports Physical Therapy that gets our athletes better faster, and stronger. And that's early. And then how do you progress that athlete all the way onto the field with a ball in their foot or a stick in their hand or whatever their sport is, and teach them how to accelerate, how to decel, how to change direction, and all the mechanics that go in there. What drills do we use to get our athletes exactly where they need to be back on the field and even better than before injury? And I want you to sign up for that class. Now, you can find it on our website. You can shoot us a direct message and just say, hey, send me the course. It's right now on sale, so make sure you sign up now. It is fully accredited to get you all of your continuing education hours. Sign up for the True Sports Masterclass ACL from table to turf. Thanks, guys. So as you begin this journey of entrepreneurship and you look at opening your own clinic in the Grand Rapids area, tell me what has shocked you. What is so easy with opening your own practice, and what has been the hardest part of opening your own practice?
First thing is lawyers are expensive.
Freaking expensive, dude.
But you know what? To be fair, you're paying for the 10 years of school that they went to, just like we try to justify. I think, you don't want to get me my soapbox how grossly underpaid I find PTs are, but the lawyers are very expensive. A lot of hoops to jump through, but I love like every part of it. To be honest, like I don't mind. I'd rather pay an expert to help me on the the legal side, the accounting side, just to do things right, rather than to try to save a few bucks here where it bites me in the butt later on. Again, like I'm also in a fortunate position where I didn't have loans coming through college because I used basically all the money I made playing hockey to pay for school. But I have a little left over that I saved in order to start up the practice. And I've started a few businesses before, so I'm familiar with how it works. So that's been the surprising part, is just like how many lawyers are going into it. But I love, the best part is the outfitting and the designing. Like I'm a creative person, not super artsy, but I'm creative in the terms of like, how can I get the right aesthetic? How can I make the clinic a place where people come in and it's a great experience? Where they come to my clinic after coming to other PT centers and they're like, well, this is different. This is the way that I want to be treated. I like the feeling I get here. I like the amenities. I like all the extra things that we get. And so that's been the fun part. It's more expensive part, but it has been the fun part, knowing that long term, it's going to be better overall for the business side of things, to have a clinic that, one, I love to go to each day because it fits my dream, but also each athlete or high performing individual that comes in, it's giving them experiences they've never had in the PT. And a lot of them are probably going to come from like a PT mill sense. And so it's just going to really help change the way that they see PT and the way that PTs, treat them as an athlete.
Yeah, that's really awesome. So tell all the listeners where they can get the best information that you would say, both on the strength and conditioning / rehab side, like the clinical side. Where can they get awesome information to rehab elite hockey players? And then where can they find information on starting their own business or going down this entrepreneurial journey?
Yeah, that's a good question. So in the hockey rehab and performance, I think the best way to do it is honestly like reach out to some of the top people that are there. You'd mentioned you had Jeff on the podcast. I think he's a really good resource. Just go on social media and find people that are at that point, that are doing something that
Give me some names, Jamie. Who should they be finding? Because you've already vetted them. So outside of yourself, who looks like you 10 years down the road?
That's a really good question. I'm not when it comes to the goalie side of things, I have to say I think I'm really at the forefront because I'm the first, first former pro that I can know of that got the DPT that's going through these things. So I'd say myself, someone like Jeff. If you look at the things like Matt Nichols is a strength coach out of Toronto, really good. Gary Roberts, strength conditioning, is really good, former pro player out of Toronto. Jeff is a good asset. When it comes to the rehab side for hockey, there's I know like Blue Iron Physio in New Jersey has been pretty good. I've spoken to them a few times. When it comes to goalies, I'd honestly probably say myself for right now until a few other like PTs kind of build that sense. I just say like reach out and just kind of like get sort of just like collaborative thought and feedback, because we can look at all the textbooks and stuff that we want, but if it's best to answer those questions on like a case by case basis, the way that I see it.
And then how about on the business side? Is there someone you found tremendous value in?
Yeah. I haven't done any of those, like any sort of like PT entrepreneurial things yet. I have looked at coaching services. From the business side, I honestly, like, I get a lot of my, like, the good stuff from books, and I get those good book recommendations from like different podcasts. And I think the PT Podcast is pretty good as well, for PTs, but I like non PT specific business podcasts. So if you look at someone like, like an Alex Hermosi, who just overflows your feed with general information, you can pick and choose that general information how it applies to you. My First Million, I think, is a really good podcast, as well. They give a lot of good book recommendations. I just pulled up my phone. Oh, How I Built This is an NPR podcast. I think it's really good because they get on like really big time people. And then the We're Gonna Make It podcast too, which I think, like, being able to hear from people who have created things in, whether it's, SAS services or other internet marketing, and like now the way that the PT sphere is going with that, with insurance just continually becoming worse and worse in terms of reimbursement and making things difficult, we as PTs need to start to look more at kind of like, what are other successful businesses doing to create a long-term success, whether that's in the cash base or in the insurance-based model, but really kind of diversifying our abilities outside of just being able to treat patients, which sucks because not a lot of people want to be business owners. Some people want to be PTs and business owners. Some want to do one or the other, but we kind of have to be it. I think in today's day and age, we kind of have to be really good. And you also have to be good at social media. You have to be good at all these things. And we talk about like going to PT school to become generalists at PT. We kind of have to be generalists at business as well in order to promote our services so that our profession doesn't die off, or we just get overwhelmed and something happens in the healthcare system that eventually just makes it impossible for PTs to even be PTs.
I think that's a great point. I think the burnout rate and the peel off rate and the way you see how many PTs stay in PT is just dwindling. I think it's because of exactly what you're saying. And that's why I'm a huge proponent of increasing our business education inside of our graduate schools, because I think by and large it's piss poor. But I think now that we have outstanding resources, like you mentioned, the Hermosis of the world, and just all this podcast stuff that is out there, I think you've got to consume it. That's why I wanted to kind of drill down to see, like, what is it that you found value. And I think you gave us a lot of great resources there. Funny story about How I Built This. I think it's a great pod, although it's a little bit overproduced. But I remember listening to it one time, and I'm like, they had the founder of Morning Brew on. And I didn't know what Morning Brew was, but it was it still is an insanely popular, almost like a daily periodical, which was it's an e-newsletter, and they sold it for $75 million. And the guy who found it was on my JV basketball team that I coached. So I coached this kid like 5 years prior. He had just had a $75 million exit with Morning Brew, and I heard him while I was working out, listening to Austin Reef was his name, but How I Built This. Pretty amazing. So you never know like how far kind of these people can go, and the information is out there. I just think it's super worthwhile to hear from guys like you to say, there's so much information. What is the good information? So I appreciate you highlighting this. Dude, I could talk to you for another 6 hours. You dropped one F-bomb. So if they're all that questioning about your language, it was one F-bomb. Lavecchio was way more vulgar than you were.
I know. I actually try, like, I tried to be as professional as possible. I know. It's sometimes it's hard. If we ever go out and meet in person, have a beer, then it's going to be a different story. But I didn't get too heated on things, but I really enjoyed this. I think it's a good question. I also want to shout out Proform Physiotherapy in Australia. Their team on Instagram, I follow a lot of their stuff, and I think they're doing an incredible job. They've started to launch a few different things that I haven't like joined, but I definitely will in the future. But from like a social media point, I think they're killing it. They don't have a massive following, but their aesthetic, their team environment, the way that I would like to kind of operate my clinic. So I'll give them a shout out too. Because
Awesome.
I use a lot. I take a lot of their stuff, whether that's blatantly stealing or stealing artists. I use a lot of their stuff
Right?
as inspiration for a lot of my own content, because I just think they just do an incredible job.
Well, that's super awesome. And I've learned a ton, and hopefully our listeners have as well, listening through this conversation, and just understanding the sport specificity and the position specificity and your approach is really eye-opening and refreshing. So thank you so much for sharing it. Tell us where we can find you on Instagram, and tell us about all the things you got going on. It sounds like you do remote coaching. There's a lot, so give me the rundown.
Yeah, I appreciate that. You can find me on Instagram. It's at JamiePhillips30. That's easily the most active social media platform I'm on. Definitely hoping for a TikTok ban because I'm not very good at TikTok. Yeah, you can find me there. So what I do is I do a lot of remote training, strength and conditioning, remote rehab stuff for goalies primarily. It's called the Elite Goalie Method. In-person coaching stuff as well, and yeah, I say all that information, honestly, go to my Instagram. It's all there. The website, if you go, just Google elitegoaliemethod.com, that'll fill it up. And I think I'll probably have like a portfolio website. I think just drjamiephillips.com. I'll just probably release that in the next couple of weeks. It's kind of more like the resume, guide people to the right spot kind of thing. Or like reach out to questions.
That's awesome. And we'll put up a link to your podcast as well so people can start following there. And dude, you've been awesome. I'm looking forward to continuing the conversation and just staying in touch. Thanks so much for being here, Jay.
Yeah, thank you. And I appreciate your time for having me on.